Expressing concern that grocery shops, vegetables and other vendors can be potential spreaders of coronavirus infections to a large number of people, the Union Health Ministry has advised state and union territories to take up testing of such people to ensure early detections of cases, which can lead to a reduction in mortality rate. In a letter to the states and union territories, a secretary in the Health Ministry, Rajesh Bhushan, also stressed on the need for the operations of listing ambulance transport system with oxygen facilities and quick response mechanism. He underlined that refusal rate of the ambulances must be monitored on a daily basis and brought down to zero. With the COVID-19 pandemic now spreading to newer areas in the country, Bhushan said there are likely to be scattered cases, a cluster of cases or a large outbreaks in districts, and that the primary aims is to control the outbreaks, especially in the new locations. He pointed out that early detection of cases through aggressive testing, prompt isolations or admissions in a healthcare facility and ensuring proper clinical management are major components of a mortality reduction. Bhushan stressed on the enhanced surveillance for the influenza-like illness as their symptoms are most likely the same as COVID. Once a positive cases is identified, a prompt contact tracing should be undertaken and at least 80% of the contacts must be identified and quarantined within 72 hours. He said normally a person would have an average of 30 contacts for a period of tracking, that 2 days before the symptoms onset, Bhushan said. There can be a potential hotspots for the spread of the infections like the industrial clusters with a close work environment, people coming from a high prevalence areas, other high density areas such as slums, prisons, old age homes, among others. In addition, grocery shops, vegetables and other vendors can be a potential spreaders of infection to a large number of people. Testing in such areas and of such people should be taken up proactively as per ICMR guidelines, Bhushan underscored.